Assessment of maternal-fetal transmission of HBV. Chronic hepatitis B infection is a serious public health problem which can cause cirrhosis and hepatocellular carcinoma. Vertical transmission of HBV has become the main source infection in children. It's approximately 5%. High maternal viremia, co-infection with HIV and certain obstetric factors increase the risk of mother to fetal transmission, MTCT, of HBV. The objective of this study is determining the risk factor involved in the vertical transmission of this virus. A pregnant Algerian woman was born in 1987, 2 pregnancy and 1 parity. Depending on epidemiological context, she had dental care and scarification. Without comorbidities, she had 167 centimeters and 87 kilograms with Nandes BMI 31.2. The patient was diagnosed with chronic HBV before 1 year ago. All household members are referred for testing and vaccination. Before conception, HBV DNA level was high, about 24,568 UI. She took an antiviral tablet 0.0 milligrams one day. This antiviral was stopped after the positive pregnancy test during the first prenatal consultation. However, at 32 weeks of gestation, it switched by tenofovir, 1 tablet of 300 milligram on day. As well, the HBV DNA level was at Brookings 56 UI, and as well as ultrasound normal and upper endoscopy was normal, and fibroscan fibroscan was down with the activities 0 and fibrosis 1. All blood tests was normal. It was a vaginal birth. The pregnant women gave birth to a healthy baby who had a normal Apgar score without any malformation. In the maternity ward, hepatitis B vaccine and the specific immunoglobulins were administered to the infant within 24 hours after delivery for preventing the vertical transmission. Baby's hepatitis markers and liver function tests were found within normal limits at 14 and 50 and 25 weeks after delivering. It's a chronic hepatitis antigen HBE negative with viral replication mutant virus without cytolysis. The first question is, what is the risk of transmitting the virus to your baby? The risk of maternal infant transmission is related to the HBV replicative status of the mother, which correlates with the presence of HBE antigen, as 90% of HBE antigen positive mothers transmit HBV infection to their offspring, compared to only 10% to 20% of HB antigen negative mothers. The importance of perinatal transmission becomes paramount because follow-up data on a person infected as infant or our children demonstrated that about 25% of persons who have chronic infection die prematurely from cirrhosis and liver cancer. The second question is, does the delivery method increase the risk of HBV transmission? There has been little evidence that cesarean delivery prevents HBV transmission. Current guidelines do not recommend cesarean section to decrease the risk of MTCT in pregnant women with chronic HBV infection. Should breastfeeding be allowed? Breastfeeding is not contraindicated for HBA antigen positive mothers. Studies suggest breastfeeding does not increase the risk for acquisition of HBV. In conclusion, HBV infection during pregnancy is considered to be an important health problem due to the risk. Monitoring of liver function tests and viral loads are recommended for pregnancy women with chronic HBV. Therefore, tenofovir in pregnancy might contribute to preventing vertical transmission of HBV. However, the importance of immunoglobulins and vaccination should not be forgotten in the prevention of vertical transmission. Thank you for your attention.